Hello and welcome to the Nurse Rosa's Insights podcast. I'm your host, Rosa Hart, and today I'm joined by my friend Justin Gill. Thank you so much for being with me today.
Thank you, Rosa. Happy to be here and appreciate the opportunity.
You are an amazing figure in nursing right now. You are so humble, but you're an urgent care nurse practitioner and also currently the president of the Washington State Nurses Association, right? That's for
Yes,
all the nurses, not just nurse practitioners in Washington State.
yes, correct. We're the professional association for nurses in the state of Washington and the ANA CSNA affiliate.
Yeah. I'm really active with the Kentucky Nurses Association. So I really appreciate all the hard work you've been doing.
I am starting my second term as president for WSNA. I
Yeah,
still work
that's
full time, and it's been a great experience to connect my clinical practice with professional work that we do.
yeah, because that's a volunteer position, right?
Correct. Yes.
Yeah, it is here too. I don't know if any of the state associations really have those paid positions. Like it's all volunteer led. And so everybody's working full time and then giving of their extra time. Well, not extra time, making time where there is none, right? We were just talking about that, how we're recording this on a Saturday. And I mean, that's what we got to do. So tell us a little bit about your backstory, Justin, and how you came into nursing. Because a lot of people think, oh, that's a female profession, but then here you are. So tell us about that.
Yeah, so my journey was a little, I guess you could say atypical. When I graduated high school, I thought I wanted to go into either political science or law, um, and at that time it was the 2008 recession, and I had interned for my local congressman after I graduated high school. Was still somewhat uncertain about what career path I wanted to take. When I was in that district office, I had a good number of constituents coming in with social service issues, accessing, say, Medicare, Medicaid, Social Security, VA benefits. And during the recession, it really helped me get a good understanding of the importance and the relationship to healthcare in every single one of those situations. And my sister was in nursing school at the time. I always had an interest in science and anatomy, physiology, and uh, had really good role models to kind of job shadow and understand the role of a nurse and the very significant flexibility that comes with becoming a nurse, not just for your career, but adjusting the profession in a way that you can still move forward with your passion. So I actually changed majors right after I went to college and started my prerequisite courses and went to nursing school and in an ADN program in Bellingham and went on to get my bachelor's and become a nurse practitioner shortly thereafter. But even after I was licensed as a nurse, I never really lost that kind of passion for the larger systemic issues that are affecting our patients, affecting
Mhm.
healthcare access. And my state professional association, the Washington State Nurses Association, was a great way to help connect that passion to my experience as a nurse. And so I joined our Legislative and Health Policy Council, which really does a really intense job during legislative session to help review legislation, look at priorities. Had some experience on the WSNA board, as well as being involved at the ANA level on the ANA Political Action Committee, and also some of the work being done there. And then ran for president of WSNA in 2023. It's been, I think, a very I think every leadership experience gives you a learning experience, and it's been a great way for me to still have a role in how decisions are being made at the state level, being able to have a voice and help represent that nursing voice, especially when healthcare is kind of in the limelight a lot right now as far as policy decisions go. Um, and I really do. I love this professional association. I love this profession. Um, and folks will always ask me, it's like, well, what's your plan? Why are you practicing clinically and then doing this? I really see them as complementary. My experiences at the bedside give me a really good understanding of issues that patients and nurses and actually all of healthcare is facing, while at the same time having the ability to impact that at a broader level. So for me, it's been a great experience thus far and still a lot of work to do. I never have looked back. I've always been happy to I chose nursing as a profession because it's really been able to support me in my passion and my work so far.
Oh, definitely. And every now and then you get a win that lets you know that you're on the right track and you're making progress, even though big wheels turn slow and there's no bigger wheel than our government and those policies. So, have you had any policy wins that you'd like us to know about?
Yeah, I think so. From at the state level, we've had some success in at least implementing a staffing law that was passed a few years ago, which really helped solidify staffing committees. Obviously, there's a lot more work that still needs to be done at that level. Nationwide, staffing still continues to be an issue for nurses and health systems across the board. And so, that was a major win. Also, when we look at, issues that are impacting us at a broader level. There are policy changes that happen all the time at the state and federal level. And sometimes a lot of the wins are really pushing back on changes that actually may actually impact our patient populations in a negative way.
Mhm.
And so, pushing back on certain pieces of legislation that would have changed the, assault definition for certain nurses in or behavioral health settings, and only
Mhm.
isolating those nurses as a lower charge. So that was one piece of legislation that we were able to push back on.
Good.
At the national level, we know that there's been some regulatory changes and executive orders that have impacted our patient populations here in the Pacific Northwest, particularly related to healthcare databases on LGBTQIA plus individuals, pregnant women. And so, we joined forces with some of our other professional associations in the State Medical Association, Association of Nurses and AIDS Care, and a few others, and in bringing a lawsuit against Health and Human Services to have them restore some of those databases in the spring. And fortunately, we achieved a settlement with the federal government. And in September, I believe, the federal government agreed to restore some of those websites. So some of the ones I'm talking about are the HIV risk reduction tool with the CDC and many other databases and resources that nursing researchers use. And as we move forward, a lot of what we're looking at now is how do we protect our healthcare system? How do we protect nurses in their roles, especially as we work during a very difficult time? And then also, how do we look at some of the incoming trends in nursing like AI?
Mhm.
And how do we navigate those situations at the state level and contribute to the discussion at the national level as well?
Yeah, and well, I'm gonna wanna talk about AI some, that would be fun. But before that, let's talk a little bit about financially, how do you go about suing the federal government and, like, who pays for that? Because I don't know about you, but my experience with nursing associations is, like, we don't have extra money for stuff. So, who was paying the attorney fees for that?
So there are national groups that help advance some of these particular issues, and when we look at other lawsuits like Doctors for America, on some other database legislation and other pieces of litigation, they've been in coalition. So they're it's where a particular law firm and a particular group in a specific area may have common interests and common standing on a particular issue and come together. So the cost is never usually, I mean, oftentimes legal efforts can be very costly, but when we work in coalition with other groups, then we can get a better, I think, a better uh, group that's in a better level of standing on a particular issue. And then two, also being able to pool resources, or at least utilize resources in a more effective way. Now, there's different ways to approach these types of issues, but certainly having good networks with advocacy groups that have those connections with law firms or other groups that are looking at the same issue, that certainly can help with at least bringing forward something if it needs to in the legal realm.
Excellent. So, back to AI. What are you wanting to do with AI in Washington State for nurses?
Yeah, it's funny how AI is just moving so quickly right now. Part of the issue I think is that AI is moving so fast that we're not even catching up with it at the pace that it's advancing. And our approach in Washington has been that AI nurses are innovators. We're not going to oppose innovation that improves patient care, improves our ability to do our jobs effectively and efficiently, but also does so safely, ethically, and equitably. So in Washington State, we're looking at when you see the term AI or AI nurse or AI physician. What does that mean? What does title protect? What does the title of physician or title of nurse really mean? What is considered healthcare services? Those are very big, broad questions that are being asked, and what we're looking at the state level. Um, we're fortunate enough to have be in the Seattle where there's a lot of innovation, going on as far as health tech goes. But it's important that we have nurses at the table when decisions are being made, not just at the state level, but at the institutional level. So, when organizations roll out AI, making sure that we have the people who are providing the care, informing how that innovation or that change should be rolled out. And then the other piece is really making sure that, you know, that our health systems are not utilizing AI to replace nurses, but to augment the really important work that we do. For example, I use AI when I see patients as an NP. I use a DAX Copilot, which helps transcribe patient notes. It allows me to look at my patient, assess them, talk with them directly, and also helps with my documentation ability. But the accountability and the decision making is still made by myself as a licensed healthcare provider. So I think moving forward, as we look at bills that may come up or bills that we may want to introduce, how do we still protect that human versus human taking care of a human concept that retains accountability, and for that particular licensed professional?
Right. And I mean, I think it's a great opportunity to have the conversation about what does it even mean to be a nurse or a doctor? Like at one point, wasn't there some kind of robot they were calling an AI nurse and it was just carrying samples to and from the lab? And it's like it doesn't take a nurse to do that. And also, you are wasting a nurse's time if they have to physically carry that to the lab. Like anybody can physically carry something to the lab.
It's a good reminder that folks still don't always know what nursing is. So,
Right. Exactly, and so, no, it was not gonna replace a single nurse, but saying that it was a nurse was so confusing, like, "That's all you think nurses do, really?" Well, then that's an opportunity for a conversation, right? Um, and then, our friend Stephen Ferrara has created that course about AI for nursing. Have you checked it out yet?
yes, I put myself on the waiting list and just enrolled in one of the first courses, which
Me
I'm excited to
too.
start.
Yeah, me too. I did the little intro thing and then I got interrupted, so I gotta go back to it and finish it. I wanted to, like, be the first one to finish it. But, yeah, I'm really excited about having tools like that to introduce AI to people and, like, also recognize how are we already using AI and we don't even know it, right? Because a lot of the time, it's been running in the background doing things for us and we didn't realize it. And also just giving people a picture of what it could be capable of and what we could direct it towards and identifying, hey, we have this pain point. Is there a way AI could solve for it instead of what is already made and available? Let's step back and just see, okay, what are the problems? And if we were going to use AI to fix it, could we? Is there a way to use it? And in that AI first framework.
Yeah, and actually, it's interesting because this week I attended a Microsoft AI summit in Bellevue or Redmond, Washington, where it was focused on AI and healthcare. And I think a lot of the discussions that were brought up really still kind of stem back to foundational and systemic issues that have existed in healthcare for a long time. Looking at
Right.
things like transparency, looking at things like access to care, looking at issues like behavioral health care. And I think we oftentimes look at innovation of AI in healthcare in a clinical sense, like a direct, clinic, like using it in the clinical setting. But I also think it can play a major role in being able to help with transparency. So, for example, knowing how much something is going to cost based on your insurance plan and the contracted rate with, say, a
Yeah.
healthcare organization. I don't know of any other business where you go into a clinic or a hospital and you can't get a clear answer on how much your bill is going to be or how much you're going to be end up paying based on a certain rate, until after the care is provided, and then you just get the bill and have to pay it. I think that there's a lot of innovation that can happen there
You're
so that
right,
people
and
can
allowing
navigate.
people to shop around, right? Because how many people don't go see any doctor for whatever's going on for them because they have no idea how much they're gonna get stuck with paying, and they figure it's better to die at home than risk my
Yeah.
family going bankrupt over this issue. Like, is this issue worth bankruptcy? It's not even a conversation necessarily about, "Will this kill me?" but is it worth risking bankrupting my family? Because a lot of people are more
Yeah.
afraid of that even than dying of whatever their condition is.
Even navigating the system. I mean, how many of our
Mhm.
patients, a lot of the problems that occur with following up on visits, following up on diagnostic tests or medications has to do with navigating the system, navigating getting a medication covered, navigating following up and getting a referral approved. I think that there's a lot of improvement there that can be made from, with utilizing AI, because right now we're not doing a great job of it. And that's a major problem for patients. So, yeah, I think with any innovation, always excited about the innovation, always willing to see how it can improve our ability to provide care and improve care outcomes, but also at the same time making sure that we still maintain that the ethical standards and the standards that really make sure that our patients are being well taken care of and that our profession is able to continue serving those patients in a effective way.
Definitely. I think this brings us to our $1 billion question, Justin. Are you ready for this?
Yes, let's go for it.
I know you are because we prepared. But, the question is, if you were given a grant for $1 billion to meet the needs that you see in healthcare, how would you like to see it used strategically to have the most sustainable impact?
Yeah, I actually believe that we really need to look at the future of the profession. We have to see how is it that we can make sure that nurses or nursing professionals represent the populations that we care for.
Are you saying nursing is a profession?
Yes, I apparently it's a
Oh,
controversial topic now that we're whether
apparently.
we're a profession or not. But yes, we are a profession regardless of how it's recognized right now, at least by the Department of Education. Nursing is a profession. It is the most trusted profession. And it's important
Right?
that we invest in that.
Yeah.
So I really would bolster our ability to make sure that we're giving nurses opportunities not just to go into licensure, but also expand their education to get graduate education and make sure that they can pursue their own goals and also help impact the health of our communities. We know when nurses do have access to continuing education or continued advancement in their degrees and career paths, that the health outcomes of that community improve significantly. We have a primary care crisis in this country. We have a behavioral health crisis in this country. A lot of that is due to systemic problems, but that would be probably the first thing is making sure we're bolstering our nursing workforce. I think that the decision by the Department of Education to exclude nursing as a profession is a major area that's going to have significant ripple effects across the healthcare system. And oftentimes those effects aren't realized until they're actually there, until those patients lose access to care. So I'm not willing to really give up on that effort just yet. But even with that, we really need to make sure that we're continuing to develop the future nurses of this country. And then the other piece to it is, I think, is also looking at investing in healthcare resources for our communities. I think that a lot of philanthropy has supported local efforts to be able to provide people with, say, behavioral health care, scholarships, primary care access. I think that right now we really need to look at what are some models of care that actually help reduce cost, improve outcomes in the community setting. I think a lot of obviously people look at healthcare from a sick care system and an acute care setting, but we really have to look at how can we really invest in public health, outpatient access to care, behavioral health, because I think that those are the drivers of why we're seeing much more acuity and higher costs of care in the acute care setting. So I think the future of the nursing workforce, as well as investments in local community and public health.
I think you're absolutely right, and so many of those places are like the federally qualified community health centers, and so are there any models that you're thinking of right now that you would love to put more support behind, like any like nursing-led models or direct patient care that you've seen making an impact in prevention?
Well, yeah, I think I wish there was one program. There's a lot of different programs that are out there. when we look at, say, providing care in the outpatient setting. From behavioral health care, I think just having that immediate access, that seems to be the biggest barrier for folks is folks don't know where to go, how to access those systems. In my community, we do have behavioral health clinics that are available for on a walk-in basis,
Mhm.
which actually significantly reduces barriers and improves people's ability to access those systems. When we look at things like long-term care, that we have an aging population with limited resources, and we see the sandwich generation having to deal with, raising families and then also taking care of their aging parents. And many of those parents don't have the resources to be able to care for themselves. Obviously here in Washington State, we've had the Washington Cares program, which has had some successful wins at the ballot box by voters in Washington State to help invest in a fund that helps support long term care. And then also public health. I think that across the board, public health has been underfunded and continuously, I think there's been a degradation of the support for public health over time. Even after COVID, which, I wish that was a reminder for us.
You mean especially?
Yeah.
Yeah, especially after. Did you get to watch the debate that Dr. Mike was part of at Johns Hopkins?
I did not, no.
Dude,
I
you've
gotta
gotta
watch it.
see it. I'm gonna make some clips and post them because it was
Yeah.
just sheer gold, because, I mean, one of the things you and I wanted to talk about during our call today was misinformation and, public health is supposed to be the source of real information, but, there are 3 people there in this debate with Dr. Mike at Johns Hopkins,
Oh, I
and
have seen clips of this, yes.
yeah, there
We
need to
talked
be
about
more
partisan.
clips
Yep.
because it was long and it was all very important
Mhm.
because, like, they kept reiterating, "Oh, well, accurate information is boring," and he was like, "That's funny. How'd I get 10 million views then? Are you saying it wasn't accurate?" No, it doesn't have to be boring to be accurate. You just need to reframe it, and, hey, we can use AI. Say, "How do I say this in a more fun way or in a way that will be more catchy?" And wouldn't that be a great use of AI, don't you think?
Yeah, if we have I mean, I think there's 2 sides to that, where AI can be we have to be cautious as far as how misinformation can potentially make its way through AI because a lot of the information we give is very nuanced, right? And how we deliver information is very nuanced. If we have guardrails to make sure that AI is accurate and based in actual information and reasoning, then I think it definitely could be a helpful tool. What I found really passionate about what Dr. Mike said about public health and also misinformation is that the way that we communicate with folks really needs to adapt to the way that people are getting their information
Yes.
because we can say things about how people are getting their information, but that doesn't change necessarily how they're getting it. And we need to meet them where they are
Mhm.
and use the modalities that are effective in still delivering the same level of truth, the same level of evidence based practice. Because the evidence is great if it's there, but if we're not disseminating it in a way that is effective and lands with the clinicians providing care and the patient populations that get the care, then that evidence doesn't necessarily provide much benefit in that sense.
Yeah, it's so true, and, I mean, I've been in so many rooms with in so many different conferences with, like, researchers and people who are in charge of these really super legit websites who are like, "We're getting no traffic to our website where we have all of these answers, but people are getting all their answers on TikTok." And I'm like, "Well, take your information from your website and put it on TikTok where they are." And when I say we can use AI to reframe it, if you prompt it and just say, say this in a more engaging way, and here's the information, and you look at it and you make sure it doesn't change any of the facts and figures,
Exactly.
and but it might be able to say it with different words and suggest a different pacing and maybe some fun sounds to go with it or
Yeah.
some fun pictures to illustrate it. It really can demystify the process.
Absolutely. Absolutely. And I think that that's going to be essential with this because yes, facts, figures, tables can be boring to folks, especially if they don't have any background or specific context.
Yeah.
But we really have to. I mean, I like to look at this as how we have those conversations with our patients, right?
Yeah.
We meet people where they are. We understand their situation. We talk to them in a way that they can understand at the bedside to help them, and we are great at that. we need to be able to utilize those skills and translate them at a broader level to make sure that we're disseminating information that's accurate, that's evidence based, and that also counters narratives from, say, voices that may be spreading misinformation, disinformation, or malinformation. So I think that it is an opportunity to be able to allow people to change their messaging, adjust their messaging in a way that lands better with those patients and those communities that they care about.
Yeah. And I really appreciate how you are raising awareness and putting a lot of great messaging out on social media, especially on LinkedIn. And this is a great time to talk about using LinkedIn because it's not just a place to go if you are looking for a job or looking to hire somebody for a job. It's a great place to meet other people who are interested professionally in the same things that you are. Like, I think you and I found each other on
Yeah.
LinkedIn. I don't think you and I have ever been in the same room, but I feel like I know you because I see you on LinkedIn every day. So,
Yeah, it's a great opportunity to be able to network, also bringing up professional issues that come up and being able to identify people that may be in a particular same specialty, maybe doing work that you're already doing. I've enjoyed and valued LinkedIn. Obviously, every social media platform, everyone is gonna there are some downsides to it, but that's how we're engaging now. And to lean out of social media when especially when it comes to trying to advance professional work, I think that there has to be some presence there in some capacity to be able to meet other folks, especially with how fast things are moving right now. It's kind of a necessary step in order to be able to do that.
it is. It's a good way to connect with people who are outside of your locality. And so, yeah, I just wanted to put a plug out there because a lot of people think it's just for if you're looking for a job or if your title includes the word leader in it. And no, it's, just for people who have interesting thoughts and they want to talk about them and maybe not in a social context, right? It's not necessarily, oh, we have to be friends, but also, am I reinventing the wheel here and somebody else is already doing what I'm trying to do? And then you can find out about it and find new partners for research or to publish with, or like that's happened for me. So that's been an amazing opportunities. Well, Justin, if someone wants to reach out to you to discuss any more of these topics, what's the best way to reach you?
Yeah, so I am on LinkedIn, and you can certainly share my LinkedIn information. I am also on other platforms as well, like Instagram. It's at gill.justin, and on other platforms like Blue Sky, which I think that they all offer their own kind of ability to network and get through information. But I'm on those platforms. You can easily send me a direct message and reach out to me. Um, and happy to connect and collaborate on any issues related to nursing or healthcare.
Yeah. And for our listeners, if you've enjoyed this episode of the Nurse Rosa's Insights podcast, make sure you are following or subscribed on whatever platform you are watching on, or if you are listening on Spotify or Apple Podcasts. And please leave me a comment with your thoughts if you agreed with what we said, if you disagreed, or if there's someone else you know with $1 billion answer to my question and they need that amplified, that is what I'm all about. So, Justin, again, it was an honor to have you on here, my friend. And I appreciate you coming in all the way from Washington State to my little basement in Kentucky through the internet.
Well, it's an honor to be here with you, Rosa, and I appreciate the work you're doing. You know, we're talking about meeting people where they are. People like podcasts, so kudos to the work you're doing, and I hope you continue doing it and getting the word out.
Well, thanks. I sure will try. And besides the podcast, you can find me on the social media platforms, most of them, at Nurse Rosa Speaks. Feel free to reach out to me there or on LinkedIn. I will have Justin's and my contact information in the show notes. So feel free to reach out and we will work on making the world a better place together. And I'll see you in the next episode.